Hello, everyone, and welcome to our program today. My name is Rene Cantu. I am the Business Outreach Manager for Equality Florida, and I am joined by my colleague, Andrew Lent, who serves as our Healthcare Equity Trainer here at Equality Florida. And today's program on the LGBTQ plus affirming healthcare is going to focus on issues impacting persons living with HIV. And we've invited a few of our colleagues to share some of their insight and to share shed some light on what those issues are and what our friends at Broward Health are doing to be prepared to address those issues. As you may know, this community outreach is part of Equality Florida's partnership with Broward Health to ensure that members of the LGBTQ plus community receive healthcare that is both affirming and is provided with the respect and the dignity that we all deserve. I want to talk a little bit about the program that we're doing with Broward Health. Andrew, you've recently come on board with us. What are your thoughts, or what are your impressions of what we're doing with Broward Health?
Yeah, thank you so much for the introduction, Renee. So as Renee said, I'm Andrew Lent. I'm Equality Florida's lead healthcare equity trainer. And so basically we've partnered with Broward Health because especially during the pandemic, we've seen a lot of the inequities in health, especially for the LGBTQ community, and especially for our transgender community and people of color. We've seen them really widen and become more prevalent. So this program is helping to address gaps in cultural competency among medical professionals and healthcare facilities and to promote best practices. So as Renee said, I've started leading the trainings this year, and I'm glad that Broward Health has been such a great partner. And these trainings include everyone from front office staff to doctors to nurses. And during these sessions, we focus on aspects of affirming care that a lot of healthcare staff may be unfamiliar with. So this starts with just a discussion of terminology and some of the specific concerns of LGBTQ patients, such as HIV, discrimination, visitation rights, and then we discuss best practices on how to treat transgender patients. And this including affirming names and pronouns on intake forms, on IT, room assignments, and bathroom policies. And that's just some of what we cover. But this is really a commitment between healthcare facilities and the LGBTQ community. And this is part of our effort to also reach out and let everyone know all of the services available at Broward Health.
Yeah, and I think it's important that we demonstrate to people that they are learning and coming up to speed on how to navigate those issues with the trans community. But then it's also for the LGBTQ plus community in general. So everything from, if I were to show up at the hospital with my same-sex partner, they know how to react and not to have a bad reaction. And because, it's all about making us feel comfortable and feel like we are going to be taken care of in a manner that is helping us to get better from whatever is ailing us. So we're really excited to be partnered with Broward Health. And we're hoping that we're going to be able to do these types of partnerships with other healthcare organizations across the state. So now let's get started with our panelists. So just as a note, we're going to be hearing, as we hear from them, in the comments section on the side of the screen or beside us, whether you're on YouTube or you're on Facebook, you can enter comments, you can enter questions that you might have for the panelists, and we are going to work really hard to make sure that we try to cover as many of those questions that you might have during the time that we are together. So first, I want to bring up a good friend of mine, Lorenzo Robertson. He is the HIV Prevention Interventions Coordinator at the Pride Center at Equality Park. And he's going to give us a little bit of perspective on what's the state of the HIV epidemic at this point. So I'm really kind of excited to hear about hear his comments on that. And then I'm also going to bring up Dr. Lynn Mel, sorry. He is a physician with Broward Health, and he is going to talk to us a little bit about how Broward Health is going to navigate these particular issues when it comes to HIV care, and how they're preparing themselves to moving forward, to be that organization that takes care of our community. We'll start with Lorenzo. Lorenzo, would you just give us a little bit of your background or your story, and then go right into your discussion or your comments about HIV?
Well, I'm Lorenzo Robertson. I'm the Prevention and Interventions Coordinator with the Pride Center, and I'm also the Executive Director with the Ujima Men's Collective. I've been working in HIV since 1999, so I've been around for a while. I've worked in different capacities. I worked for the health department before. I worked for nonprofits. I've worked for CBOs, ASOs, so I've been around a lot of those different areas. I think that when we think about HIV, especially when it's in referencing the LGBTQ community, is really about how do we address that population more specifically and more succinctly, and also to be more affirming of who we are. And just think about some of the milestones that we've had so far. Like in 1995, the protease inhibitors came around, and therefore that gave us an opportunity to have regimens that were more palatable for our community. So therefore you're able to take fewer pills to actually slow the replication of HIV in your system. So therefore you became undetectable, those types of things. And U equals U, undetectable equals untransmittable. Those are things that we really need to discuss and have more people have a clearer understanding of what those are as well. But I think overall, when we think about the LGBTQ community and our healthcare providers, it's really imperative, and I'm applauding Equality Florida and the work that you're doing in terms of training the healthcare professionals, because there are so many instances when people are misgendered and when they're in the hospital, or they're using their dead names, all the things that are very important to us in terms of making sure that we are affirmed when we go to the hospitals. Recently, I was involved with one of our clients, and he was in the hospital, and one of the nurses just came in and said, "I don't like you." And we didn't know if it was because he was HIV positive or because he was a same gender loving man. We don't know exactly why, but it was just the attitude in terms of that we're still enduring those types of instances and situations in 2021. We still have to endure that type of stigma, that type of discrimination. And you're just in the hospital, you're already sick, you're already in pain, you're already in the hospital, and for someone to treat you in that manner is generally disrespectful. But those are some of the things that we're still struggling with now in 2021. And again, I applaud you for making this type of education available to organizations, because it's very, very much needed.
So Lorenzo, the long term, that HIV has been around. What's the number of fatalities? Do you know how many folks have succumbed to HIV/AIDS over the years?
Over the years, yeah. Hold on one second. Let me pull that information up. I know in 1990. Last year, in 2019, we had 98 people that actually died from AIDS or HIV complications in 1999. But there's been a progression in terms of the number of people that have succumbed to HIV over the years. But we are seeing a decrease in the number of people that are being impacted or dying from those complications. So it's just a matter of continuing to make sure that people are taking their medication and actually doing the things that they're told to do by their doctors.
Good. And I know I always see statistics about South Florida and how Dade County, Broward County are leading the country in new transmissions. Is that pretty accurate?
Yeah, that's still pretty accurate. We're usually like 1 and 2 in the country, and right now we're like number 3 behind the Atlanta. DC is first, Atlanta, and then South Florida. And when they look at South Florida, they're looking at Miami-Dade, Broward, and Palm Beach County. But that number, we are still 3rd in the nation in terms of where the number of new infections among people who are living with HIV. And the most prevalent people who are being impacted are Black same-gender loving men. That's the highest rate of men who are being impacted with HIV in our community as well. So, but when we look at that, it's just really what can we do to stop the spread of HIV? It's one of our biggest issues that we still need to address. And our prevention education programs are not they're working, but they're not working as well for all populations in our community. Because we can look at the white MSM community, we've seen a decrease in the new infections in that population, but we continue to see a rise among Black same-gender loving men and our Latino community as well. So it's really, we're doing some of the same type of programs in all races, all ethnicities, but there are reasons as to why the programs are not being as effective with our Black communities.
And do you have a sense of why that is? I mean, are people just, kind of over it?
I think it's a lot of different areas, a lot of things that are compounding upon themselves, because I think a part of it is that there are entrenched systemic racism that's a part of it, the discrimination that people are still being impacted, and we have homophobia in the Black community, which is not necessarily more impactful than any other part of the communities, but we have that as well. And we still are dealing with a lot of the stigma that's still associated with HIV in the Black community. And we're still looking at how do we navigate that in terms of being open about your sexual orientation, one, but also being open about your HIV status if you're living with HIV as well. And we still have the same type of attitude from a lot of people in our community. So when you mention HIV, it becomes this whole other conversation. It's never about, well, how can I support you? It's about, well, how did you get it? It's about those type of areas, as opposed to looking at what is it we can do to stop the spread of HIV with me? So therefore, how can we begin education programs? How can we actually adhere to those programs? How can we make our community more open to making sure that we are going to not continue the spread of HIV in our community?
So you talked about the discrimination that is there, kind of the stigma.
Yeah.
So we know that there's HIV stigma, and I know of programs that are trying to work on making that go away. It's a toughie, but it's still there. What are some of the other issues that someone who is HIV positive have to deal with? I mean, you have your stigma, but then what else is kind of part of that person's lifestyle?
Well, it really depends on the individual. We have some people, their housing is a big issue with some people who are living with HIV. They don't have adequate housing. And some of our programs that are designed to provide housing for our community, they're full and there's a waiting list. So therefore the clients are still not able to access housing. People have transportation issues. They may not have cars, or they're living in a neighborhood or in environments where the public transportation is not as adequate as it could be. So therefore you're having to walk like 20 blocks to get to a bus stop, and the medical facilities that you may need to go to, they're not on the bus routes. So all these things are compounding why people are still having issues with that. Those are some of the other issues in terms also, sometimes just accessing care, trying to make sure that you're getting to the location that you need to access services for yourself. And I think it was mentioned earlier about the stigma, but sometimes it's also when you're actually going to a healthcare facility, sometimes the person at the front desk is your barrier. And they're treating you in a manner that makes you feel as though I'm not coming back to this location again. Although I know that I need to go because I need my healthcare is very important. But by the other part of it is that feel so disrespected by this person that I don't want to go back into that location. And sometimes it forces people, or it puts them out of care because they don't want to deal with that type of situation when they're going to, again, I'm already sick. I'm already trying to better myself. But then I come into your location and you're giving me this, you're adding to you're compounding my already. I may have internal homophobia. I may be homophobic. I may have all these other barriers and things that are happening in my life. And then I come to you and I'm trying to get service, and then you're going to stigmatize me even further. And so those are some of the things. I mean, we also deal with systemic racism that's in our communities as well. And also the biggest pieces for me is really trying to educate our healthcare providers and the frontline staff as to how to treat people when they come to the front desk.
And that's, you mentioned earlier, or you were complimenting us about how we're doing that work with Broward Health. And we're hoping that we're going to be able to touch base with more of the healthcare organizations in our area, in the state of Florida, to make that happen, because we realize that there is stigma, that there is stuff that we need to kind of work through, so that everybody gets the care that they need. Just one final question, and then we'll start. We'll talk to Dr. Lin. How has COVID and the pandemic affected? I mean, what have you seen? How has it affected folks that are HIV positive, and how are they? What are additional struggles that they're dealing with in their day-to-day stuff?
I think one of the biggest pieces, because with COVID, we were all forced to stay home. And I think it just increased the isolation for some people who are living with HIV. They were already isolated prior to that. And it just kind of pushed their isolation to a higher level, because now they're afraid of going out of their home, because if they are going out, they're already living with HIV. They don't want to get COVID. They want to die from that. But so it's just I think that was a part of how COVID actually impacted the people who are living with HIV as well. It just continued to increase the isolation that a lot of people are struggling with already. And you were not given the opportunity to go out. A lot of things are done through Zoom now, but then there are people who don't have access to a computer or a smartphone. So therefore, they're still isolating themselves, and they're isolating because they don't have access to some of the things that other people take for granted. I mean, I take my laptop, my cell phone, I take all those things for granted. So everyone has them. Everyone doesn't have them. And that's the thing that we have to sometimes recognize. How do we address some of the issues that we feel as though they're universal, that everyone has access? And we realize that everyone doesn't have access to a lot of those things. And the isolation just continues to compound upon itself, because especially during the COVID pandemic.
Yeah. Andrew, did you have something else that you wanted to ask?
Yeah, I just wanted to point out so many things that Lorenzo said that were great, and especially talking about, you mentioned like housing, social isolation, technology, which is a huge issue that we don't often think of with older adults who have HIV and health needs in general. But something I also wanted to point out is lack of affordable transportation is another one that comes to mind that we don't often think of. But I'm so glad you talked about front office staff, because that's not something a lot of people who are cisgender or heterosexual think about being a barrier to care. And so part of what we're doing with Broward Health is we're talking about intake forms. We're talking about their technology. We go over on the forms how to ask for what is a patient's Affirm name and put it into the system so that they avoid being misgendered, whatever. But we also ask, what is their legal name, so that we don't have to use it, but we have to look up in your system, what is the name on your insurance? What is the name on your ID? So that we can use it when necessary, but not to you to further stigmatize you or prevent you from getting care, because we've seen a lot of research saying that's one of the major reasons that people are hesitant to get care. And it starts really in that first interaction the patient has. So I'm glad you brought up a lot of those points.
And then I promise this one will be my last question, as opposed to the one that I asked before.
Okay.
But we just got a question in the comments from my good friend Larry Scott. That says, since Florida is sadly leading the nation in new HIV infections, can we assume that we're also leading in other STIs such as syphilis and gonorrhea?
Yes, they're all kind of go hand in hand together, because when someone is living with HIV, or when they've opened themselves up for HIV, then generally it's something that's precipitated by other STIs, syphilis, gonorrhea, chlamydia, all those things. They kind of go all hand in hand, and we're leading the nation in those areas as well. He's absolutely correct.
Yeah. Thanks for the question, Larry. And during the pandemic, he and I had a running joke that we call each other Pam-demic as our drag name. So I'm getting points for actually saying the name on the air. Dr. Lin Mel, why don't you take the mic, as it were, and tell us a little bit about your background and your work, and then go right on into how Broward Health is working with this particular population.
Well, hello, my name is Dr. Mel. It's very nice to be speaking with all of you. I am one of the doctors here that works at Comprehensive Care Center. We are a clinic that is an arm of Broward Health in the community health services area. And what we focus on pretty much is HIV primary care, hepatitis C treatment, hepatitis B treatment, and gender affirming medical therapy. We also do a lot of community outreach in terms of HIV testing, and just pretty much trying to get our name out there so people know that we are here and that we are here to service the Broward County and surrounding area in regards to HIV primary care, whether you have insurance or not. That doesn't matter to us. We just want you to come in so that you can be seen. One program that we do run is something that's known as test and treat. All right. So if you are diagnosed with HIV, like, in the community anywhere, and you are seeking care, especially if you are diagnosed by us, by one of our community health teams, you can come right on and we fast track you in to make sure that you get the medications that you need and that you're in the proper services, so that you can continue to get the medications that you need. From that point forward, we also deal with all other disease processes that we find along the way, whether it's diabetes, high blood pressure, hepatitis C, hepatitis B. So one of the great things is that I trained in Atlanta at Emory. I did the IDSA fellowship for HIV and hepatitis B and C treatment. So I'm versed in treating the inpatient and outpatient aspects of HIV and associated disease processes. So it was kind of like from the frying pan and into the fire, because I came from Atlanta to another place that had a ton of HIV prevalence as well. And I'm really grateful to be able to bring my services down here.
Dr. Mel, I was wondering if you could talk about, as a physician, the importance of PrEP and PEP, which is pre-exposure prophylaxis and post-exposure, and how that can be a tool we can all use to help prevent HIV and the importance of access to it.
So I think those two options, like especially with PrEP, since that's only been here for like a good number of years now, has really revolutionized HIV prevention. And I think it's really important. And they've even come out with new guidelines now that like everybody who is sexually active should be told about PrEP, not just, MSM or, people in the LGBT community, which really, really pushes forward the importance of HIV prevention and that people should know about this. Pretty much in terms of what we have for PrEP now, it's pretty much a daily pill. It's either Truvada or Descovy that you take every day that has been shown to decrease, the ability to catch HIV by 94%, which I think is straight up amazing. All right. So for people who are on it, who are at higher risk for HIV, it's pretty much a godsend. It's just like at the end of the day, we really need to get over the stigma of HIV, as well as getting for a lot of people, you take PrEP and people just assume, are you HIV positive? Or it's just like, are you, so promiscuous that you need to take this medication? Those hurdles definitely need to be jumped over and explained thoroughly to the community that this is more about, protection. And at the end of the day, knowing your body and knowing, what your risks are and making sure that you're taking care of yourself. And that should never, ever, ever be looked down upon. There's a lot of new exciting technologies on the horizon in regards to PrEP as well, including an injectable form that you only have to take every 2 months. And for, especially for communities where there's a high amount of stigma, where people don't want to leave evidence of things like, a pill that you have to take every day, I think that's really going to address certain, barriers to care. But at the end of the day, I think PrEP is a great, great thing to have. And PEP is extremely important too, especially for our patients to know. Knowledge is power when it comes to NPEP. And what NPEP is like, if you are exposed to HIV, if we can get you on medicines as soon as possible, like within the hour, ideally, say, like you've had an exposure, whether it's through a needle stick, whether it's through, unprotected sex, we want you on medicines ASAP to decrease the incidence of actually catching HIV. The sooner you're on it, the evidence has shown that we can prevent like it actually from taking hold.
So, what have been some of the challenges that you've seen that Broward Health has been faced with in terms of providing this care? And when I say challenges, I mean challenges by the hospital system itself, challenges in reaching out or reaching the folks that actually could benefit from your care. What have you seen?
So in terms of my experience here down in South Florida, I just moved here last year to take the position here at Broward Health. And HIV care has evolved immensely from, like, say, the early 90s. All right. The pill burden has decreased like immensely, and the drugs that we have now are much, much, much more tolerable. You know, we're down to a pill a day, and they have extremely high barriers to resistance. So to become resistant to these medications, you know, takes a lot of issues with adherence and things like that. But that being said, the biggest hurdles are not necessarily the medications. All right. It's the psychosocial aspects and stigma that's associated with HIV. All right. We work a lot extensively with the Black and Brown communities, as well as the immigrant communities of Broward Health. And the stigma that's associated with HIV is immense, especially, say, the Haitian Creole community. When we get a lot of women here, their big goal is like, how can I hide these medications so no one can ever find out that I have HIV? And they're extremely isolated. They don't want anyone to know. One of the things that they're grateful for is that our clinic doesn't have HIV in its name. All right. Because if it did, that would be one gigantic deterrent for them to even walk through the door. And when I trained in Atlanta, the Ponce Center is known as the Ponce Center for Advanced HIV Medicine. And 80% of the time when I would do a test and treat there, they were like, why do you have HIV in your name? I don't want to walk through the door because HIV is in the clinic's name. And that just really, really shows you how much stigma is still out there in regards to HIV. Yes, it's become a chronic illness, but it's not like diabetes. It's not like hypertension, because you can scream out to the world you have diabetes, you have hypertension, and people will actually want to take care of you and not say, you know what, this is on you. This is something that you did, and then shun you for it. They're just going to be like, you need to get the treatment. They understand the systemic issues that come along with diabetes, that comes along with high blood pressure. But for HIV, it's still this thing of like, you know, you did this to yourself, only promiscuous people, only gay people. Those myths are still running rampant, especially through minority communities. And it's those issues that really, really are the biggest hurdles for getting people to, you know, take their medicines every single day, for getting people through the door. That's why our main goal whenever we treat somebody or whenever we test someone in the community is get them in the door as soon as possible so that we can dispel those myths. And even when we try to dispel those myths, they hold on to it for dear life sometimes because it's just ingrained in them.
Yeah, you're everything you just said is spot on. I mean, there is so much stigma still. I mean, even amongst the LGBTQ community, even amongst people that are HIV positive. I mean, there's the stigma is prevalent, and it makes it so hard to identify and to provide that care. What has been your experience there at Broward Health in terms of how committed the organization is to the work that you're trying to do?
So that's one thing, especially when I interviewed at Broward Health, was like, you know, my question is just like, you know, how established is your program? It's just like, how much support are you willing to give me in regards to, you know, keeping this clinic running and making sure that we provide for the community? And that was one of the main reasons I actually was just like, you know what, this sounds like a phenomenal position for me to take, because they were just like, Dr. Mel, we want to make sure that this clinic continues to thrive and continues to provide the support that's necessary. We are something that's known as a safety net hospital for Broward County, meaning that like if someone falls out of care anywhere else, runs out of insurance, they can come to Broward Health and get the care that they need, and we will provide it. All right, with or without insurance. If you have no insurance and you are recently or like previously diagnosed with HIV, we will ensure that you get into the Ryan White program and get the care that you need. All right, there are special programs to get you on, insurance where Ryan White will even cover your premiums. So there's a lot of options. And then we also have a fallback option that's known as MOPED, which is insurance that is offered specifically through Broward Health. And if you qualify for that, it is all free. One thing that when they brought me on board, my big question was just like, will you allow me to do gender affirming medical care, and will you allow me to make sure that the clinics here learn how to do it correctly and learn how to provide an environment for trans individuals to actually feel like they are welcome? And will you allow me to teach other clinicians to do the therapy so that, more doctors can do it? I was really surprised in that there's, only 4 or 5 doctors who do gender affirming medical care within Broward County. A lot of times they'll either have to go to Miami-Dade, or they don't even know that like someone like me exists that can provide it for them.
Yeah, and we actually heard from one of the physicians, endocrinologists from the clinic, the last time that we did this program. I forget her name,
Dr. Kenningsberg?
Yes, she's amazing.
She is. I am actually working with her because she's a pediatric endocrinologist. So we're working on a transition of care for all of her pediatric patients when they turn 18 and they're looking to get adult care to transition to our clinic.
Yeah, I mean, it's so good to see the commitment from you guys to provide this service and to provide this care. Andrew and I recently had a conversation with another healthcare organization that is at a place where they are able to provide that same care in those same areas, but they happen to be located in an area that's a little bit more conservative than Broward. So I mean, even their waving of a rainbow flag got people up in an uproar a little bit. So the community was concerned, or they made complaints, and staff made complaints. So they're in a very precarious position in terms of how they're able to kind of promote the fact that they are wanting and willing to provide that affirming care. So it's, number one, it's great to be here in Broward County in our sort of blue bubble. But it's also great to hear that Broward Health is committed to continuing and doing that.
So I think one of the big things that we're doing, especially when we do community outreach for HIV testing, we let them know, like, this is HIV primary care. We also have other services that we provide, especially to the LGBT community. That's why, like, at the end of the day, I want everyone to know there's a place for someone to come if they need gender affirming medical therapy. They don't need to buy illicit substances to use like on the black market. Like back in the day, they used to buy like horse estrogen. It was crazy what people would have to resort to because they didn't have a doctor who was just willing to actually, work with them and provide them like, with the medications in a safe space. And like we're learning now that like in providing a safe space, whether it's for drug use, whether it's for gender affirming medical therapy, it's good care. The numbers are there. It shows that, people thrive and like survive better if those places are offered. And it's, for the medical community, that is our job. That is why we are here. And I just wish more, medical professionals understood that.
Yeah. Um, so I'm looking to see if there are any questions from our viewing audience, and I don't see any. Just a reminder, if you're watching and you have any specific questions that you'd like to ask to our panelists today, feel free to put them into the comments section, whether you're watching us on YouTube or on Facebook, and we will get to them as soon as we see them. So moving forward, Dr. Mel, you talked about technologies that are coming up, and we already understand how committed Broward Health is to being that place to come for care. What else do you see? I mean, do we see a cure anytime in the near future? Do we see anything else? And Lorenzo, you can chime in also if you want.
So there is a ton of research that is being done, especially in regards to an HIV vaccine, especially with newer technologies out, especially with the COVID vaccine is a novel type of vaccine known as an mRNA vaccine. They're looking into, mRNA vaccines for things like HIV, but it's still at the bench research phase. So it's still in its infancy. But they're still doing a lot of research in regards to the mRNA vaccine and HIV vaccine. The research, they have been working on that for God knows how long, forever and ever and ever and a day. And they always, have this quote unquote promising vaccine. But until I see them get to stage 3, stage 4 clinical trials, I'm not going to hold my breath in regards to that. But it's still important because on a global scale, an HIV vaccine is what we need. We can't just keep on going the way we're going in regards to expensive medications, especially for developing countries, and think that we're going to eradicate HIV in that manner. All right. It's great that first world nations, have a 90-90-90 goal, but then we also have to think about the rest of the world. It's not just England, Canada, France, the US that suffer from HIV. All right. The whole continent of Africa suffers from HIV. All right. And they also, should not be this hotbed of this is where first world nations go to do research. We should also be making sure that, they are getting the same quality of care that people in first world nations get. But that's another discussion to be had. But there's a ton of research. The medications that we have now was pretty much on the backs of research that was done 10, 15 years ago when it comes to protease inhibitors, integrase inhibitors. They have revolutionized the field of HIV medicine. All right, to the point where people can take a single tablet a day. They have absolutely no side effects. The only side effect I really talk about is in the first 1 to 2 weeks, a little bit of headache, a little bit of nausea, and it disappears, especially if you take it with food. What other medication, especially for a disease like that, can be offered so simplistically? Diabetes is harder for me to treat than HIV these days. Just from a medical perspective, not a psychosocial perspective. But from a medical perspective, HIV is extremely easy to treat. It's just getting people on the medications and getting people to accept their diagnosis that can be the biggest hurdles.
Yeah, and you just talked about all the research that has been done for in support of finding a vaccine. The COVID research benefited. I've heard this. I read about this, but the vaccines that they were able to create for COVID benefited from all the research that was done in developing an HIV vaccine. Is that right?
No, that's very, very true. Just because in regards to the mRNA vaccine, the history of mRNA vaccines, I was reading about this, is extremely, extremely interesting and extremely political too. But at the end of the day, COVID definitely did benefit.
And so speaking of COVID, how did the COVID, the last 2 years, how did that impact the way you were able to deliver your services at Broward Health? Now, I know you said you started about a year ago there, but during that time, you came in during COVID.
Yeah, and it was during my fellowship too, which was kind of crazy. But we really had to like pivot a lot in terms of making sure that the staff were safe and making sure that these are people who are a lot of them are immunosuppressed, especially if they're uncontrolled in regards to their HIV. So we have to take that into account. We couldn't have clinics that had packed waiting rooms or more than 6 to 10 people per room. That was just too risky. So we had to find ways, like especially in terms of telehealth and phone calls, to make sure that people were okay. Was it 100% ideal? Absolutely not. But we had to find a way to still provide care and provide it in a safe manner. Because it could be for a person whose CD4 count is 100 and their viral load is detectable. If they're on it and they decide to come visit me, but they end up catching COVID and they are in the hospital, it wasn't HIV that killed them, it was COVID. And that was something, you know what I mean? These people work hard to get to a point of where they accept their diagnosis, where their, HIV is under a certain amount of control. The last thing I want is for like some blue moon disease to hit them and just take them out suddenly. All right. They work too hard to get to a point where like their disease process is under control. So we always have to take that into account. So on our end, we try our best to make sure that we still provide care, still provide medications in the safest manner possible. The great thing with Ryan White and a lot of the insurance companies were just like, you know what? If you need to give 6 months worth of supplies, that's fine. And them just allowing us to do that, allowing us to bill correctly, especially for telephone visits, I thought was like really great on their part, so that we can still provide the care that's necessary. It's not ideal, but it's a workaround. But thankfully, the vaccine is here. And the big thing is like there's a ton of vaccine misinformation and vaccine hesitancy in regards to COVID. But our clinic is definitely saying like, please, 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 we are pretty much begging everyone. And I'm begging everyone out there. My eyes are getting big for a reason. Please, if you have not gotten the vaccine, get the vaccine. It is safe. I've gotten it. I've gotten my booster. I am still alive. They found no microchips in me, nothing.
Well, I had my microchip put in, years ago, but that was way before COVID. So
yeah, and even if they put a microchip in me, I'm boring. You know what I mean? It's just like, what are they gonna find? Me cooking roasted chicken in my office?
and I've got to be able to find myself when I get lost. Anyway, Lorenzo, did you have any other comments on that?
No, not really. Not.
No microchip.
No, none that I know of.
Dr. Mel, I know you talked a lot about having HIV under control, and I know Lorenzo talked about this a little earlier. I was wondering if you could elaborate more on U equals U, where it's the undetectable equals untransmittable, just from a medical perspective.
So I think that is an extremely important campaign. This data came out from two gigantic trials known as the Partner 1 and the Partner 2 trials. The Partner 1 focused mainly on heterosexual and homosexual relationships, where the Partner 2 trial specifically looked at MSM. And it pretty much showed that if there's a viral load that is under 200, you literally cannot give HIV to anybody. So anyone who became HIV positive in those studies, like they did a genetic analysis and found out that they did not catch it from within the relationship. It was from outside of the relationship. All right. So, and the data was really, really robust too. All right. They waited in regards to doing the U equals U campaign until the data for the Partner 2 trial came out. And when that data came out, it was just like, look, if your viral load is under 200, you literally can't give it to people. And they had the power of those studies behind it. And I think it's really, really important because it's one step forward to, eradicating that barrier in regards to HIV. But I think in the medical community, the way that we counsel, sexual education, especially in the era of U equals U, definitely needs to catch up. Because, at the end of the day, yes, condoms prevent a lot of STDs, all right? But it's also that discussion, especially, what risk are people willing to take? And with U equals U, if you're like, say you have 1 to 3 partners, all right? They all get tested regularly. They're all on PrEP. Then you talk to them like, hey, you're taking your medicines every single day. Your viral load is undetectable. Your partner's on PrEP or on HIV, positive and undetectable. If you decide not to use condoms, you know what I mean? And that's a risk that you're willing to take. You're taking it in the safest manner possible because number one, all the partners are getting tested at least every 3 months for other STDs. And we have the power of that study to show us that if you are undetectable, you can't give it to other people. All right. It's allowing people to really take hold of their own sexual health and not feel stigmatized by it.
Awesome. So, Dr. Mel, if we have someone in the audience who is looking for care, how do they reach your clinic, or where do they?
Right.
Is it online?
So we are at 1101 Northwest 1st Street. You could always just walk right on in. All right. And if you say, hey, I tested positive, one of our testers here will retest you and will get you into care through our test and treat program. That being said, I also have a work cell phone that if anyone has any questions, they can just text me. If they're like, hey, I heard from so-and-so that I need care. All right. I'm living with HIV. I want them to contact me so that, we can get them into care ASAP. And my work cell is 754-715-7691. It's the same number that I give to every single one of my patients, so that they have 24/7 access to me. Because a lot of times, if any medical emergencies pop up, if any issues with the pharmacy pops up with their medications, I don't want it to be at the next office visit when they address it with me. That's that would mean that that's 2 months where they were without meds because of some little misunderstanding at the pharmacy. I never, ever want that to happen. When I start you on meds or when our clinic starts you on meds, we want you on them forever and ever. And we don't want any barriers in between you and your medications.
Cool. And then are you connected with the folks at like the Pride Center with Lorenzo, Broward House, SunServe, all the other nonprofits that are sort of at the front line working with some of our population?
Yeah, so we have a lot of case managers here who are in connection, especially with Broward House. And I talk to the people at Care Resource as well as Henderson on a regular basis in regards to providing psychiatric care, as well as for housing assistance. So our case managers, they're phenomenal people. I honestly, think whatever higher power is up there, that they are still here working with us to provide those services for our patients.
Cool. So Lorenzo, I have one follow-up question for you, because I know that you're at the Pride Center, and you work directly with the population. What do you hear out in the streets or wherever about how people are able to access care, or if they've had issues or problems? I mean, you kind of alluded to it earlier, but can you talk a little bit more about that?
I mean, most people, accessing care is very simple here in Broward County. I mean, we have a lot of programs that are phenomenal. A lot of the case managers, they do a really great job. So we don't have a lot of issues in terms of that. The problem usually comes when people have issues in terms of their own personal approach to how they want to manage their HIV. And it's about them as opposed to not having access to care, because the care is available. If you don't have funding, there's there's opportunities for you to get care even if you don't have money. So we have the Ryan White program, which is the payer of last resort, but it does pay for your medication, pays for also offer housing programs. So the care is there. It's just really whether or not the person is willing and wanting to seek care at this time.
Cool. Okay. I don't see any other questions that have come in on the chat. So just a reminder, if you have a question, please feel free to put it into the chat and we'll ask our panelists. That's really all of the questions that I had. Andrew, did you have anything else that you wanted to ask our panelists today?
Well, this is something more of like personal interest, but Lorenzo, I'm aware of a lot of the work that the Pride Center does with older adults, especially in Wilton Manors, where I know Renee is. I was wondering if you could talk about, as we're seeing HIV become a disease that people can control and live with, some of the struggles that older adults have, especially as they age, with HIV, access to treatment, and if you could just touch on that.
Man, again, with the access to treatment, I think that's usually not a barrier because the access is very accessible. I think some of it for the people who are living longer with HIV, the problem becomes that so many people, when they were initially diagnosed with HIV, they thought they were going to die within 2-3 years. They were going to be dead by now. So some of them they're not financially prepared to live until they're 60 and 70, 80 years old. So those become some of the barriers for people who are living with HIV. And a lot of them, they have other health issues. And most people, they're going to die from other non-HIV related issues. And the health issues that they're being impacted with, those are the things that's more paramount in their lives now than their HIV, because as Dr. Mel was saying, you take your one pill a day and your HIV is fine, but you may have other health issues that you have to deal with. And those are going to be some of the issues that's going to be more prevalent in terms of your day-to-day health issues as opposed to HIV. Oh, Dr. Mel, I did have a question for you in reference to U equals U. How does that relate to, like, I know in the state of Florida, if you are living with HIV, it is a 3rd-degree felony not to share your HIV status with your sexual partner. But in the state of Florida, the science and the legalities are not connecting, because if U equals U is correct, and I know that it is, but the state of Florida does not look at it that way.
So the unfortunate thing is you're very correct, especially in the South. The laws that we have in the books are like very, very much anachronistic and don't reflect medical science at this point. So what I usually tell people, especially people who are living with HIV, be upfront with your diagnosis. At the end of the day, it is not worth it to hide it and have someone find out, and then it can become, if they get angry, you are in a position of absolutely no power. You are pretty much, held to the whims of your partner's anger, and you don't want that. If you put that on the table, it becomes a non-issue afterwards. It's a decision that, and also it's 2 consensual adults. The other person also has the right to make a decision if they're uncomfortable. At the end of the day, they're uncomfortable. If they understand U equals U, and still have that, gut feeling of discomfort, they have, every right to walk away from the table. But that also shows you, like, I would say to them, that also shows you, even when presented with, a certain amount of information, people will still go by their gut feelings. That's not a reflection on you, but a reflection of stigma in society. But it's just really, really important to be upfront with your diagnosis so it becomes a non-issue, especially in the South. Because at the end of the day, like, the unfortunate thing is the punitive damages that result from, HIV non-disclosure historically have been really, really bad.
True.
Especially for people of color.
Yeah, definitely. Oh, I did have a question in reference to PrEP also. What do you know, like, the percentage of Black people that are accessing PrEP? I know that a lot of MSM access PrEP, but do you know there's a high or low percentage of Black people that are accessing PrEP?
So the unfortunate thing is, comparatively to say like white MSM, it's much, much lower. And for especially Black women, it's even more low. We actually have a special program for, Black men and women here for PrEP services, and uptake has been unfortunately abysmal. I have, double-digit numbers for people on PrEP here, and the big thing is outreach, but also the other thing is pretty much social stigma is like the biggest thing in regards to uptake of PrEP. Having that pill and having to explain to people is like, no, I don't have HIV. I'm just protecting myself from HIV. People in the community, especially in Black and brown communities, when they see Truvada, they're just like, that's an HIV medication. Do you have HIV? And even when you say no, they're just going to assume that you're lying.
Yeah, unfortunately, you're absolutely correct.
So, like, at the end of the day, education is key, but not just like, individual education. It has to be community education. You know what I mean? It pretty much like by the bullhorns. PrEP therapy is for people who are not living with HIV. And the thing is, at least from a medical community, by the time that you get to my clinic, it's too late. This is a primary care issue, and that's what I'm trying to pretty much tell all of my colleagues. PrEP is not an ID/HIV specialist issue. It is a primary care issue. It is HIV prevention. So every single primary care doctor out there, even the ones that don't service LGBT communities, needs to offer PrEP to their patients and needs to, educate everybody in regards to PrEP therapy and the fact that it exists.
Thank you. Thank you for that.
Okay. Well, I think that brings us to the end of our discussion today. I want to, just back up just a second. When you guys were talking about HIV laws in the state of Florida, Equality Florida has been visiting and working Tallahassee every session to help them understand why it's important to modernize those laws so that we are, like you said, Lorenzo, so that the science matches the laws, so that it's not an issue, and we are likely gonna be pushing for that again this year. If there's anyone out there who is interested in helping us with some of that advocacy, we will be hosting lobby days in January. So we're going to be looking for folks to help us to take a trip up to Tallahassee to make some visits to some of our legislators at the state level, and there will be several health-related issues that are going to be on the agenda that we're going to be pushing for or against. So if you are on our email list, you will receive information about that. I want to thank both of you for joining us today, for spending your lunch hour with us today, and for those in the audience who watched, thank you for sharing your lunch with us today. Just a couple of reminders that if you want to see this program again, it will be available on our YouTube channel. If you just go to YouTube and do a search for Equality Florida and click on the videos tab, you will be able to see this show and the shows that we've done before. This is the third in the series that we've done with Broward Health. The first one was on elder care, and the second one was on youth issues. So those are also available on our YouTube channel. And you can also watch the rest of our programming, which covers a whole bunch of other areas in advocacy. That brings us to the end. So thank you very much for being a part of our program today. And thank you for watching, and have a great afternoon and happy holidays.
Thank you for the opportunity.